Before I address the efforts that we've been engaged in to push back against the Chinese virus, I want to assure the American people that, as President Trump just said, your State Department, your entire national security team is staying focused on the other diplomatic challenges around the world. Those include reducing risk to America from Afghanistan, holding the Iranian regime accountable for its malign activity, and our counterterrorism efforts against ISIS remain a priority for our team. Our number one priority across those mission sets remains the protection of the American people. The President and our team are very focused on it. I'll take this moment, too, to thank my team, State Department team, who is working long hours all around the world to take care of Americans who are stuck at places around the world. I'll talk about that more in just a minute. You've all seen Dr. Birx with me, State Department official who's doing great work, but I want to give a shout out to all of the State Department team here in Washington and around the world that are working overtime to help us push back against this pandemic. Under the President's leadership this week, we've taken two important steps. First, as President Trump announced on Wednesday, the United States and Canada jointly agreed to restrict all non-essential traffic across our border. This decision goes into effect tonight at midnight. The restrictions will be reviewed after 30 days, and they exclude traffic and movement across the border for work or other essential reasons. We're grateful to have such an outstanding friend to the north who is committed, as we are, to defeating this virus. I also want to announce today that the United States and Mexico have agreed to restrict non-essential travel across our shared border. Both our countries know the importance of working together to limit the spread of the virus and ensure that commerce that supports our economy continues to keep flowing. Here, too, the United States is glad to have a friend who's working side by side us in the fight. Secretary Wolf will talk a little bit more about the details of how we're working alongside our partner in Mexico to keep our southern border safe and secure as well. On another note, yesterday the State Department issued a Level 4 global travel advisory. This means that all international travel from U.S. citizens should be avoided. In countries where commercial departure options remain available, U.S. citizens who reside in the United States should arrange for immediate return to the United States unless they're prepared to remain abroad for an extended time. If you choose to travel internationally, your travel plans may well be severely disrupted. And finally, I want to talk about the disinformation that people are seeing, both on Twitter and around the world, some of it coming from government, some of it coming from other individuals. Just urge everyone, as they're seeing information that at one time suggested somehow this virus emanated from the United States Army, this information about lockdowns that are taking place. Every American, indeed people all around the world, should ensure that where they turn to for information is a reliable source and not a bad actor trying to create and flow information that they know is wrong. This is a tough fight. The American people are tougher. Our diplomatic teams are working around the clock to help them keep safe both home and abroad. And we're showing once again the global leadership that America has always delivered. And it's been great to see countries around the world rally behind what President Trump and our team are doing.
Well, let me start off by thanking the President and the Vice President for their continued leadership and commitment for protecting the American people during this crisis. Early on, the President, again, took unprecedented actions to restrict travel from areas affected with the coronavirus. And to date, DHS has screened over 200,000 individuals coming back from those affected countries. This has been an immense undertaking, but one that the men and women of DHS have successfully accomplished. Today's announcement is yet another example of the extraordinary steps the administration is taking to ensure the safety of the American public. Before I comment on the CDC order that I'm sure Secretary Azar will later elaborate on, let me first address the progress as Secretary Pompeo and others have made with our Canadian and Mexican partners regarding cross-border travel. As we continue to evaluate common sense measures that reduce risk and prevent further spread, it only makes sense that we have looked at the measures that our neighbors to the north and south are undertaking. And so we've been working closely with those partners since the earliest days of this virus and the outbreak. And again, as the President said earlier this week, and Secretary Pompeo, we've reached an agreement with both Canada and Mexico to limit non-essential travel across our land borders. Let me be clear that neither of these agreements with Canada or Mexico applies to lawful trade or commerce. Essential commercial activities will not be impacted. We will continue to maintain a strong and secure economic supply chain across our borders. A few examples of essential travel include, but certainly are not limited to, individuals traveling for medical purposes, to attend educational institutions, for emergency response, public health services, and individuals engaged in lawful cross-border trade. As the Secretary said, the agreements with both Canada and Mexico will go into effect on Saturday, March 21st. Furthermore, we're also working collaboratively with Canada and Mexico to take decisive joint action regarding individuals seeking entry between our ports of entry. The CDC order directs the Department to suspend the introduction of all individuals seeking to enter the U.S. without proper travel documentation. That's for both the northern and southern border. The CDC director has determined that the introduction and spread of the coronavirus in the Department's Border Patrol stations and detention facilities presents a serious danger to migrants, our frontline agents and officers, and the American people. So it's important to note that the Department currently apprehends foreign nationals from over 120 different countries around the world, the vast majority of those having coronavirus cases. Many of these individuals arrive with little or no identity, travel, or medical documentation, making public health risk determinations all but impossible. It's also important to note that the outbreak on our southern border would likely increase the strain on health systems in our border communities, taking away important and life-saving resources from American citizens. Tonight, again at midnight, we will execute the CDC order by immediately returning individuals arriving without documentation to Canada, Mexico, as well as a number of other countries without delay. And so, again, CBP is positioned to execute these measures as we continue to keep our borders secure and safe. Before I conclude, let me just wrap up by thanking the brave men and women of DHS, specifically CBP, and across the government for the work that they do day in and day out to keep the American people safe from the coronavirus. The Department has a number of frontline officers that have tested positive, as well as others who are self-quarantining, and that I am doing everything that I can to protect these patriots as they continue to defend our homeland during this crisis. Thank you.
Today's announcement is just the latest in a long line of bold, decisive actions the President has taken to protect Americans from the coronavirus spreading across our borders. In January, within 2 weeks of China's notifying WHO about the virus, and with only 45 cases in China, we began screening travelers from Wuhan. Then, over time, as the outbreak evolved, the President restricted travel from China, Iran, and Europe. Our health experts say that these measures have been truly effective at slowing the virus's spread to our shores. Just think about this. Italy and the United States both saw their first travel-related case of coronavirus around the exact same time, the last week of January. And yet we have had precious time to continue our work around vaccines, therapeutics, and other preparations, while Italy has tragically been overwhelmed with critical patients for several weeks now. The President today is taking action to slow the spread of infectious disease via our border. Under Section 362 of the Public Health Service Act, the CDC is suspending the entry of certain persons into the United States because of the public health threat that their entry into the United States represents. This order applies to persons coming from Mexico and Canada who are seeking to enter the country illegally and who would normally be held in a congregate setting like a Customs and Border Protection station. It does not apply to U.S. citizens or lawful permanent residents. During this pandemic, a number of health challenges arise when illegal immigrants arrive at our northern and southern borders and are taken into immigration custody. We're talking about significant numbers of illegal immigrants. From this past October through February, DHS has processed more than 21,000 inadmissible aliens at the northern border and more than 151,000 inadmissible aliens at the southern border. CBP facilities were never designed to hold large numbers of people and to protect agents and migrants from infection during a pandemic, nor to treat them for a novel virus if large numbers are infected. When held at border facilities, these migrants risk spreading the virus to other migrants, to CBP agents and border healthcare workers, and even the United States population as a whole. In such circumstances, the kind of social distancing measures the CDC and the President have recommended are simply not possible. On top of that, any resources that we are using to reduce the risk of infection among CBP agents healthcare workers, and migrants in these facilities are drawing on an American healthcare system that is already fighting the coronavirus pandemic. That's why the President and his administration are taking these important steps to keep Americans and our immigration system safe from these health risks as part of our whole-of-government approach to combating the coronavirus. Thank you, Mr. President, for the work that you've been doing throughout this crisis to slow the spread of the coronavirus and to keep our country safe.
So we continue to review the data very carefully from around the globe, as I know many of you are. We continue to see signs that, again, individuals under 20, 19 and under may have severe disease, but majority and all have recovered to date. We still see that same trend. And frankly, from Italy, we're seeing another concerning trend, that the mortality in males seems to be twice in every age group of females. This should alert all of us to continue our vigilance to protect our Americans that are in nursing homes. This requires all of the community, and when you see the sacrifices that many Americans have made, the sacrifices that the service industry has made to close their restaurants, close their bars, and so that the spread is discontinued, and then you really understand how all of Americans must make the same sacrifice. We continue to ask you to follow the presidential guidelines of no groups coming together of more than 10. That if anyone in the household is sick, that everyone quarantines in the household together, and that we continue to focus on those who have the most vulnerability to this illness. Now, to the moms and dads out there that have children with immunodeficiencies or other medical conditions, we don't know the level of risk, and I know you will also protect them in the same way. There just is not enough numbers at this time to really tell them if they're at additional risk or not in the same way that adults are. I don't have any new data. I can see the look on your face of saying, is she seeing something new? I don't have any new data, but I think it's important for us to be as honest with the American people as we can. And when we don't have data, be very clear that we don't know. Finally, no one is immune. I sometimes hear people on radio or others talking about, I'm immune to the virus. We don't know if the contagion levels are different in age groups, but we know it's highly contagious to everyone. Do not interpret mild or moderate disease as lack of contagion or that you're immune. You just happen to have a better immune system, and the ability to fight the virus in a way that maybe older people or people with existing medical conditions can't. And that's why it's very important at this moment that all of you carry that message about the sacrifices that many have made, particularly our service providers and our frontline healthcare workers. They are making that sacrifice every day so that every American can move through this well. But we need every American following the presidential guidelines. Thank you.
Thank you very much, Mr. President. I just want to underscore a couple of things that I've said a few times to this group. You may recall that just a week ago or so, I said the two pillars, the two elements of our capability to contain the infection and the surge of infections in this country rely on two things: keeping infections from coming from without in. We've been very successful in doing that with China and with Europe. Now we have the northern and southern border issues. There's a fundamental public health reason for doing that, because we cannot be preventing people from coming in from one area when they can actually go into the other. So that's an important reason. Understand that there's a public health reason for doing that. The second thing I think is really important is what happened in New York today, what Governor Cuomo mentioned about an hour ago, some rather strong issues that have been addressed with his recommendations. Not recommendations, essentially orders. Now, we have a group of recommendations and guidelines that are applicable to the entire country. You know them. We've been over them. Yet there are places, regions, states, cities in this country that are being stressed much, much more than the country as a whole. Clearly, one of them was Washington. Another one was California. Governor Newsom made some very important, difficult decisions. Today, Governor Cuomo did the same thing. And I want to say I strongly support what he's doing. And one thing, as a New Yorker myself, for those of you who haven't figured out from my accent that I'm from New York, As a New Yorker, I know what New Yorkers can do. We're tough. I was in New York City on September 11th, 2001, and I know what the New Yorkers can do. So please, cooperate with your governor, cooperate with your mayor. It's very important.
Thank you, Mr. President. The White House Coronavirus Task Force met this morning. We continue at the President's direction to bring the full resources, not just of the federal government, but in full partnership with our state governments, businesses around America, and a partnership with the American people to respond to the threat of the coronavirus. And I know I can speak on behalf of the President with confidence when I say how inspired we are by the way the American people and American businesses are coming together to help defeat this virus in our country. Millions of Americans are putting into practice the President's 15-day guidelines, and we encourage everyone, even those that are not in areas with significant outbreak, to review these guidelines over the next week and more and put them into practice, and you'll continue to do your part. Later today, we'll be talking with manufacturers around the country, and the President and I continue to be inspired by the way American industry is stepping forward. We have businesses around the country that are literally volunteering to retrofit plants to help us meet the needs of our healthcare workers and our healthcare system in confronting the coronavirus. As the President mentioned yesterday, following his decision to put FEMA in the lead, the emergency declaration, we actually met with all the nation's governors from the FEMA National Response Coordination Center. The President and I, our entire team at the federal level, couldn't be more grateful for the efforts of all of our governors in implementing the guidance that is being issued not only from our task force, but also in taking strong measures in their own communities to protect their citizens. We want to urge every American to heed your local authorities, listen to their guidance, and also do your part to slow the spread. We reiterated to all of the governors that the President, by putting FEMA in the lead, will continue to implement a plan that is locally executed, state managed, and federally supported, that puts the health of America first. We have received a report today, as the President mentioned, on our legislative team on Capitol Hill. We're working with Republicans and Democrats at this very hour to pass an economic recovery package that the President described, and we hope to see the Congress act on that early next week. On the subject of supplies, we continue to make steady progress on testing. Thanks to the President's involvement of commercial labs, the public and private partnership, more and more Americans are being tested every single day. And tomorrow, Admiral Gua and FEMA will update the American public on the status of testing and our support of state-based testing efforts that are literally expanding by the hour. On the subject of medical supplies, we continue at the President's direction to pursue every means to expand the supply of personal protective equipment for the extraordinary and courageous healthcare workers that are ministering to the needs of people impacted by the coronavirus. We have a policy of procuring, allocating, as well as conserving the resources that we have in our system. And now that the President worked with the Congress to make industrial masks fully available for hospitals to be able to purchase, to be able to use as protective equipment, we're more encouraged than ever about the availability of those important N95 masks to our healthcare facilities. And over this weekend, we'll be announcing a major procurement from the federal government of N95 masks as well. We're also encouraged that we're finding new alternatives to increase the supply of ventilators. We've mentioned that we have a federal stockpile, some 20,000 ventilators on standby, but that doesn't count the tens of thousands of ventilators that are in our healthcare system around the country. But the President has challenged us to work to free up other ventilators from other sources around the country. And there are two different ways that we're doing that. Number one, in our recent discussion with anesthesiologists, we've literally identified tens of thousands of existing ventilators that can be retrofitted and converted to be ventilators for people struggling with the coronavirus. But also, on the President's behalf, on behalf of all of our task force, we want to continue to urge every American and every American hospital and healthcare facility to postpone any elective medical procedures. This will free up bed space, free up hospital capacity for people that are struggling with the coronavirus, and it'll also free up equipment that our healthcare workers need. It is inspiring that we continue to receive reports that businesses around America are donating N95 masks to their local hospitals. Businesses large and small are donating hundreds, in some cases millions of N95 masks. And I know how grateful the President is, and we all are. And let me close by saying, as all of our experts have said many times, while the threat of serious illness to the average American from the coronavirus remains low, every American can do your part to reduce the burden on your health, on your family, the burden on our healthcare system, and especially the threat to the most vulnerable among us by putting into practice the President's 15 days to slow the spread. And as the President said at the outset of his remarks, I know that millions of Americans are doing that just now, and the greatness of the American character is shining forth.
You had a call with Senator Schumer. He says you've now agreed to invoke the Defense Production Act to actually make those medical supplies that hospitals say are in severe shortage. So 2 questions. Is that what you're doing now? You're using it now to tell businesses they need to make ventilators, masks, respirators. So you said you were signing this but not invoking it. This is what you said yesterday, and that you would only do so in a worst case scenario. Yeah. So are we now in a worst case scenario?
In New York, is there any more consideration to a national lockdown to keep people in their homes? A week into your 15-day guidelines, are you happy with the progress?
There's been some concern among Democrats on Capitol Hill that the Phase 3 fiscal stimulus is weighted too much in favor of corporations and not enough in terms of individuals. What did your conversations with Senator Schumer yield on that front? Same page with Senator Schumer? And to Dr. Fauci, if I could. Dr. Fauci, as was explained yesterday, there has been some promise with hydroxychloroquine, this potential therapy for people who are infected with coronavirus. Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no. And the evidence that you're talking about, John, is anecdotal evidence. So as the commissioner of FDA and the president mentioned yesterday, we're trying to strike a balance between making something with a potential of an effect to the American people available at the same time that we do it under the auspices of a protocol that will give us information to determine if it's truly safe and truly effective. But the information that you're referring to specifically is anecdotal. It was not done in a controlled clinical trial, so you really can't make any definitive statement about it. John, you've got to be careful when you say fairly effective. It was never done in a clinical trial. They compared it to anything. It was given to individuals and felt that maybe it worked. So
was there anything to compare it to?
Yeah, well, that's the point. Whenever you do a clinical trial, you do standard of care versus standard of care plus the agent you're evaluating. That's the reason why we showed back in Ebola why particular interventions worked.
Sir, on that topic. Mr. President, about the possible therapies, yesterday, Mr. President, you said that they were for, quote, immediate delivery, immediate. Dr. Fauci said there is no magic drug for coronavirus right now, which you would agree. I guess on this issue,
I think we only disagree a little bit.
Sorry. Is it possible that your impulse to put a positive spin on things may be giving Americans a false sense of hope? Nearly 200 dead. What do you say the Americans who are scared, though? I guess nearly 200 dead, 14,000 who are sick, millions, as you witnessed, who are scared right now. What do you say to Americans who are watching you right now who are scared?
The units that were ordered, are they for clinical trials or are they for distribution to the general patient population? We understand all that. I'm just thinking of the application here. So that would be under sort of a modified compassionate access?
Like Dr. Fauci, if you don't mind, to follow up on what the president is saying. Should Americans have hope in this drug right now? And sir, I would like to follow up on Peter's question here. Could you please address Americans in this country who are scared right now? This is a very valid concern that people have.
No, there really isn't that much of a difference in many respects with what we're saying. The president feels optimistic about something, his feeling about it. What I'm saying is that it might be effective. I'm not saying that it isn't. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we are making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. So there really isn't different. It's just a question of how one feels about it.
Is there any reason to believe it's not safe?
Well, certainly as a drug, any drug, John, has some toxicities. The decades of experience that we have with this drug indicate that the toxicities are rare and they are, in many respects, reversible. What we don't know is when you put it in the context of another disease, whether it's safe. Fundamentally, I think it probably is going to be safe. But I like to prove things first. So it really is a question of not a lot of difference. It's the hope that it will work versus proving that it will work. So I don't see big differences here.
At home, who have their children in their homes right now, who are homeschooling, doctors who say they don't have the masks they need to do their jobs. Your message to them.
The first question is, many small businesses are concerned that they have weeks, not months, and are worried about how long it'll take. Second, if I may start, are you concerned about members of Congress that may have used information they learned on updates to sell stocks and profit off of this?
Mr. President, so the whole group would include Richard Burr, the head of the Intelligence Committee, and it also would include Senator Kelly Loeffler. And so the question is whether or not they should be investigated for that behavior.
You said the other day you see yourself as a wartime president right now, leading the country through this pandemic that we're experiencing. Do you really think, going off on Peter, going off on a network is appropriate when the country is going through something like this?
I do.
China has been in communication with the United States and also WHO about coronavirus
Right,
in
that's true.
January.
That's
and
true.
the U.S. shut its border to travelers from China on February the 2nd. Also, Wuhan has been in lockdown since January the 24th. And this all happened almost 2 months ago. Why did you still say if you could have known it earlier?
More about stock buybacks. Many of the airlines and Boeing did stock buybacks. Is this a deal breaker for you? The exemptions on work travel, can you define that? Is all work, anyone with a work visa can still cross the border?
Mr. Secretary, the Mexican government has not announced any travel ban on Europe. Have you been in touch with them as to when they're going to do this and what it is that they're telling you? And then a second question, they also are telling us and said in a press conference this morning that they will not take back any non-Mexican citizen. Any other third parties will have to, we don't know what will happen to them. So can you address what will happen to those third country immigrants that you are saying that will not be allowed to enter the U.S. and Mexico is saying that they will not be allowed to stay in Mexico either or sent back from the U.S.?
And again, as we implement the CDC's order, again, we're going to take a number of individuals that cross the border illegally and repatriate them or remove them quickly back to Mexico, back to the Northern Triangle, and back to any other country. So we're going to do that in a rapid fashion. We'll continue to work with Mexico to make sure that Mexican nationals go back as well as other populations.
But are you sending Guatemalans back to Guatemala or Cubans back to Cuba? What would you do with those third countries that are not Mexicans?
So we're doing all of the above. We're going to be sending, again, individuals back to Mexico, individuals back to the Northern Triangle countries, Cuba, Haiti, all of again, 122 different nations that we see nationalities that come across that border. We'll be sending them back individually to their countries, but also working with Mexico to send additional populations back there as well.
On the issue of disinformation, is there any particular locus for this disinformation, or is it diffused?
The American people to be coming to trusted sources of information. Does it undermine you at all when the president stands up here and he attacks news outlets calling us untrustworthy?
In terms of Americans who find themselves stranded in places where there are no longer flights to get back to the United States, what efforts are being made to help them? Is there any sense of just how big that problem is?
How long are these border restrictions likely to last along the south and north borders? Have you determined whether Iran is responsible for that rocket attack last week?
The Peace Corps volunteers that are in 60-plus countries, have they all been returned? Secretary Esper's not here, but to get tests to the troops in Iraq and Afghanistan, are you able to give us a progress report on the status of that if they're all able to get tests?
Pompeo, how exactly are you going to get those Americans back, and do you have any plans to get the military involved in that?
Secretary, question on Iran again. Is there any consideration to relaxing sanctions on Iran during the coronavirus crisis since they've been particularly hard hit? The sanctions themselves, no movement.
For the president to call your department the Deep State Department at a time when thousands of diplomats are working very hard around the world to combat this pandemic?
The news, I have two questions. The first to Secretary Pompeo. The news hours learned that the CDC picked up that there was some sort of virus happening in Wuhan, the coronavirus happening in Wuhan as early as December. When did the CDC start letting other agencies know that there was something in China happening, that this coronavirus was happening? And then when did the whole government approach start to happen?
So we were alerted by some discussions that Dr. Redfield, the director of the CDC, had with Chinese colleagues on January 3rd. It's since been known that there may have been cases in December, not that we were alerted in December.
What message do you think it sends to other countries when you have the President of the United States lashing out at reporters?
Actually being reported that the news media.
Mr. Secretary, Senator Johnson has suggested that you and the administration may be overreacting. He said, we don't shut down our economy because tens of thousands of people die on the highways. We don't shut down our economies because tens of thousands of people die from the common flu. At worst, 3.4% of Americans will die from this virus, he said. What do you say to people that have that view? That's 11 million people he's talking about. Mr. President, to follow up on that, there are millions of people out there that share that view, that say, I don't really need to shut things down, I don't really need to stay away from stores, I can go to the beach. And those people making multiple actions exponentially, it's the difference between life and death.
First of all, I think that's a false equivalency to compare traffic accidents with. I mean, that's totally way out. That's really a false equivalency. When you have something that is new and it's emerging, and you really can't predict totally the impact it's going to have, and you take a look at what's going on in China, and you see what's going on right now in Italy, and what's happening in New York City, I don't think with any moral conscience you could say, why don't we just let it rip and happen and let X% of the people die? I don't understand that reasoning at all.
In New York, where cases are doubling every day, they fear that supplies are going to run out in a matter of weeks. Yesterday, Mayor Bill de Blasio called on you to mobilize the military to deliver urgent supplies. Yesterday he said, quote, the fate of New York City rests in the hands of one man. He is a New Yorker, and right now he is betraying the city he comes from. I've personally spoken to emergency department nurses who say that they've been told not to wear N95 masks because supplies are so low. So how do you respond to those remarks by Mayor de Blasio?
Just on illegal entries of people who are OTM, how will the turn-back process work? Will they be taken to a common area and then put on a plane and sent back to northern countries or others? I mean, how would that process work?
Again, it's a public health crisis. So what we're trying to do is limit the amount of contact that we have with these individuals, not putting them in Border Patrol facilities, ICE detention facilities, and the like. So it's going to be very rapid. We're going to obviously take them into custody and then send them back to a port of entry or other means. So it'll be very quickly. It won't be the 6 or 7 or 10 days that we currently have. It'll be much more rapid.
But if they are OTM, will they be taken to an airfield
That's
nearby?
correct.
Or?
That's correct.
And sent back home?
Absolutely.
As the bill is proposed creates sort of tiers of checks for income. Do
Yeah,
you believe
it will be.
philosophically
Well,
that
we're working
makes
on it.
sense?
Wall Street analysts are predicting that unemployment numbers could skyrocket next week. By some analysts, say as many as 3 million people applying for unemployment, which would be a historic number in a 1 week spread. So is a $1,000 check going to cut it?
What projections for job losses in March and April are you hearing?
President, on the issue of supplies, you've told governors to try to find whatever supplies they can on their own. But some of them are now saying when they go to try to buy them, they're being outbid by the federal government.
There are reports saying that the Labor Department has told states not to disclose their unemployment numbers. One more clarifying question, if I could, on the DPA. I just want to be clear. Are you saying that the administration is requiring these industries to create these products, or just asking?
President, how do you help out states and localities that are trying to bid on things like ventilators and other items but are being outbid?
There are labs across the country that don't have the testing supplies they need. What specific actions is the administration taking?
I tell you what.
What specific actions
We inherited
are
an
being
obsolete
taken?
deal, and we made a good thing out of it. I haven't heard that question in a while, but go ahead.
Yeah,
Why don't
so first, we're making tremendous progress in terms of lab testing. Tens of thousands of tests are being done every single day, both through the CDC and the public health labs, as well as now through the private sector commercial labs. They're getting to scale. They have supplies. They have high throughput. We do hear anecdotally occasionally of, say, a public health lab or another one that has a concern about this supply or that supply. Through FEMA, we actually are standing up a laboratory task force to answer those questions. Usually it's that the lab people do not understand that there are actually alternative supplies in the marketplace that they are perfectly free to use. We've actually had to put out some common myths and truths about that. For instance, the other day, we were getting calls from governors saying, we don't have swabs, there are no swabs, there are no swabs. Our supply people went in the open marketplace and bought 200,000 swabs in the open market, and I just sent a letter to every governor sending them swabs. So some of it's just they aren't listening or checking with us about all the freedom, all the capacities out there. It's a complex system with 330 million Americans and all of these labs. So sometimes there's a lab that doesn't understand how much flexibility they have and how much supply there is out there. And we're working through the new FEMA Integration Center to help correct that for folks.
Well, as I said, more and more tests are being performed every day. And as we learn about the results that are being reported around the country of coronavirus tests, our experts continue to look at the numbers and see that some 90% of Americans that are tested do not test positive for the coronavirus. And so it can give you a sense of the magnitude of testing that's going on. We have the number of cases that we've reported today, but it's in some cases near to 10 times that have been tested. But let me also emphasize how important it was in answering these questions for governors and local officials that the President stood up FEMA and the National Response Center, where we briefed governors yesterday. Now every governor and their state health departments have the ability to reach out to our regional FEMA administrators. And that's how, as the President said, we're sorting out those potential conflicts between very significant federal purchases and procurements and as hospitals and state governments are purchasing as well. I think the new streamlined system operating now in all 50 states and our territories of governors and states going through their regional administrator for FEMA is going to make it more possible for us to ensure that our hospitals, our healthcare providers have access to what's available on the open market and elsewhere.
Mr. Vice President, you're the head of the task force. You've seen the numbers. You've spoken to average Americans. You're a former governor. What do you say to Americans right now who are watching and who are scared?
I would say do not be afraid, be vigilant. All the experts tell us that the risk of serious illness to the average American for the coronavirus is low. But we need every American to put into practice the President's coronavirus guidelines, 15 days to slow the spread, because the coronavirus is about 3 times more contagious than the flu, according to our best estimate. And you can contract the coronavirus, have very mild symptoms, if any, not even be aware that you have it, and expose someone who is vulnerable to a very serious health outcome. That's the reason why we're encouraging people to avoid groups of more than 10, to not eat in restaurants, but to use drive-thrus, to wash their hands on a regular basis. And particularly, we're going to continue, as the President has directed us, to focus on the most vulnerable population, which are seniors with serious underlying health conditions or anyone with an underlying immunodeficiency. It's those people we need to care for, but it's going to take all of us working together to make sure they're safe.
Clarification, because you just said that you haven't had to require companies to up their production of medical supplies, but you said last night you invoked the DPA. I'm confused.
When we need something,
This is important. You haven't actually directed any companies to start making more ventilators or masks.
This is partially for you, partially for Secretary Azar. You said yesterday that you had spoken to Carnival Corporation's chairman. Yes, and he said that he could donate some ships.
No, not donate. That's not the word donate.
Okay, lend.
He's not giving them. He's going to let you use them.
Okay, so my question is, one, it sounds like you haven't taken them up on it yet. Ships have a lot of frequently contacted surfaces, and so this is where you come in, Secretary Azar, potentially Dr. Fauci. Do you have concerns about those the cruise ships being used as hospitals?
A quick follow-up. So can you name any of the companies that you've asked to start making these ventilators or face masks? So that's Did the government ask General Motors? Thank you. And so for Dr. Fauci, there's new research out that the CDC has released that many of the people that that 13% of the people with the coronavirus got it from someone that was asymptomatic. So my question is, does that change the way the approach that should be taken? And do you think that's the case, or do you think that, or do you not agree with that research?
The recommendations that are here applies to whether you're in physical contact with someone who could be infected with symptoms versus asymptomatic. I don't really think it changes anything. Certainly, there is some degree of asymptomatic transmissibility. It's still not quite clear exactly what that is. But when people focus on that, I think they take their eye off the real ball, which is the things you do will mitigate against getting infected, no matter whether you're near someone who is asymptomatic or not. It's the same thing. Physical separation and the care that's outlined here is going to take care of both of those things.
I have a question about testing. When will every American who needs a test get a test and be able to get a test? And why not have medical equipment being shipped right now? There are Americans, though, who say that they have symptoms and they can't get tests.
Well, okay.
What do you say to the Americans who are
I'm
scared
not
that they
hearing
have
it.
symptoms and they can't get
We
a
don't
test?
want to.
Kevin Hassett is one of the people who is now suggesting that the real way to get to the end of this, for life to return to normal, is for every single person living in this country to be tested. That way you could see who's contagious, and you could then have people who don't have it go back to work. Is there any possibility that this country could ever get to a point where every single person could be tested, and how long would that take?
Thank you for the question. I've heard that before. I don't connect the dots there. I don't see how testing everybody in the country is going to help you to implement this. This should be implemented universally, at least at this level for everyone. The things we spoke about a while ago, that you want to really ratchet it up, like Governor Newsom is doing in California, like Governor Cuomo is doing in New York, or how you put an end to this outbreak. Testing is important. It would be nice to know, and there are certain things you could do, but let's not conflate testing with the action that we have to take. Whether or not you test, do this. I'm not putting down testing as an important issue, but people seem to link them so much that if you don't have universal testing, you can't respond to the outbreak. You really can.
Yesterday, you mentioned the possibility of aerosol transmission of the virus. How likely is that to happen?
I mean, the possibility of aerosol transmission always comes up when you have situations like that. It comes up with influenza. It came up with SARS, in which there was a documented, one-off episode of some aerosol transmission. Aerosol means that it can stay in the air for a period of time because it's in a droplet that's very small and doesn't go down. Is it possible that there is aerosol transmission? Yeah, it certainly is. But clearly, what we have seen in the situations where people have gotten infected from the areas that we have experienced, China, South Korea, now Europe, most of it is in a situation where people are close enough to each other that a symptomatic person will have a real droplet transmission. So I'm not ruling out the possibility that it's aerosol. But again, it's not going to substantially change doing this.
Dr. Fauci, quick follow-up on the testing issue. Let me just ask this in a very simple way. What is the demand pressure on testing in this country, and are we meeting it?
Yeah. I get the same calls that many of you get, that someone goes into a place who has a symptom and wants to get a test, and for one reason or other, multiple, logistic, technical, what have you, they can't get it. That is a reality that is happening now. Is it the same as it was a few weeks ago? Absolutely not, because as the Secretary and others have said, right now that we have the private sector involved, the availability, not only just availability, but the implementation of the availability is getting better and better and better. Having said that, I understand and empathize with the people who rightfully are saying, I'm trying to get a test and I can't.
So is that a way of saying we are not yet at a point where we are meeting the demand pressure?
Well, the answer is yes, John. We are not there yet, because otherwise people would be never calling up saying they can't get a test.
Well, I just can't emphasize enough about the incredible progress that we have made on testing. All of your reporting and media outlets around the country are as well, that that many, many more tests are being performed every day, literally by the tens of thousands. And this has only been made possible because several weeks ago the President brought in the commercial labs, these enormous companies, Quest and LabCorp, working with companies like Croce and Abbott Laboratories and Thermo Fisher, and said, we have this existing system of state laboratories and the CDC processing tests for certain infections. But given the magnitude of this outbreak, the President apprehended early on that it wouldn't be enough to meet the need. And I just want every American to know that literally hour by hour, in partnership with these extraordinary commercial labs, we are making more and more tests available every day. We'll detail the way that we're working with states to distribute those tests. We've obviously focused on states that have been dealing with the most serious outbreaks of coronavirus: Washington State, California, New York, and others. We've been making sure the tests are in those areas, working closely with those governors. But I think the American people should be encouraged at the progress that we are making. Tomorrow we'll take some time to detail that progress for you, but I would say to any American who might be concerned that they have symptoms, as the President said so well, we don't want every healthy American to get a test. But if people feel that they have symptoms that they identify with the coronavirus, call your doctor. Their doctor can call their state health authorities that can work very closely with our entire team through HHS and FEMA and work to identify the more and more tests that are available every day.